I'd like to welcome all of you today. My name is Saul Magana, and I'm a solutions educator with Conduent. Today's topic is Statit, more patient care and less administration. We anticipate that this session will run approximately 30 minutes. Now I'd like to introduce the presenters to you. First, we have Dustin Richardson. Dustin joined the Conduent Midas team in 2012 and is currently a product manager for Conduent Advanced Analytic Solutions. Dustin is also an Agile Certified Product Manager and Product Owner, and is the co-author of Data-Driven Healthcare Improvements, a Recipe for Provider Excellence, which is a step-by-step resource for organizations who need a framework from which to understand and master the provider quality review process. Next, we have Leanne Childry. Leanne joined the Conduent Midas team in 2019 and is currently a product specialist for both Statit and Comply. She is a registered nurse with 15 years of critical care clinical experience. Leanne also held a role with IT, providing application support for multiple healthcare disciplines. And with that introduction, I'd like to turn the floor over to Dustin.
Okay, thank you, Saul, and thank you everyone for joining our session today. Our agenda today is to review some pain points that are keeping physician leaders up at night and how Statit scorecards can help address those challenges. We'll talk about some proven outcomes for success and go into a couple of our client success stories as well. At the end, we're going to take some time for question and answers, so if you have any questions, jot them down or enter them into the chat. We'll be monitoring those as we go through the session. So we're here today to sum up a pervasive problem that medical staff chiefs and chairs face multiple times per year when completing the provider quality reviews. These are also known as OPPE reviews, physician profiling, and go by a few other names. The most common responses or pain points that our partners have provided to us is that the provider quality review process is time-consuming, it's resource-intense, and it takes clinicians away from important clinical and patient care duties. So drilling down to the root cause, we'll uncover three primary pain points that end up costing organizations more in the long run, and which can end up having devastating effects on compliance and accreditation. The pain points derive from new tasks constantly being added to workloads, whether it's regulatory or organizational. In addition, unintended byproducts of extra administrative duties are proven to lead physicians and clinicians to burnout, affecting their overall quality of care that is provided. So before we move into a review of our pain points, I want to start with a quick statistic to set the stage. Today, close to 40% of physician leaders spend 1/6 of their work week doing administrative duties. And not much of that is directly related to clinical duties or patient care, but on documentation and processes that serve to evaluate providers and clinicians for compliance and in order for them to receive payment and reimbursement. So Leanna's going to go into more detail about the primary pain points we see in our market and that we see medical staff and quality organizations suffer from. Leanne, what do you have to say about this?
Thanks, Dustin. We have taken several challenges head on to improve the pain points. Our main goals have been to reduce the time spent on regulatory administrative tasks, getting clinicians back to the bedside, and overcoming workflow challenges that various BI and competitor tools just can't address. We do this by focusing on three things. The first of these is patient care. Physicians and clinicians expend enormous effort on administrative tasks. That's valuable time taken away from their patients. Next comes productivity. Reviews take focused time and effort by physician leaders and their supporting staff. When there are hundreds or sometimes even thousands of reviews to get through, time adds up and time is money. Our final focus is on tools and workflow. Many organizations today use BI tools for reporting. While these tools do present a real nice looking scorecard, sometimes they can leave clients hanging with what to do with the results. These tools lack the targeted workflows necessary to support important quality and regulatory processes with one standard user interface. Dustin, can you tell us about how the Statit solution helps overcome these pain points?
Thank you. We address these through our Statit Provider Scorecard, Batch Review, and Reviewer Summary features, in addition to our quality scorecards. And it really is a pervasive market problem that truly affects physicians and providers where it matters most. And so to address that, we offer three primary capabilities through our provider and quality scorecard modules. First is automated reporting, followed by targeted workflows and real-time data analysis. In automated reporting, Statit's custom or out-of-the-box provider scorecards replace your manual review process with automated reporting. And this allows you to display key indicator measurement data for providers and their peers. The system accesses data from multiple sources and automatically updates provider scorecards, giving you a standardized and centralized tool for reporting to both internal and external audiences. And you can choose whether or not to manage your system, or we can do it for you. We have a team of professional system administrators and system managers through our solution services team who we offer our administrative services through. And our quality scorecards help to build a culture of quality with automated data interactions for leaders, clinicians, and experts. Related to workflows, the right workflow drastically reduces the time you have to invest for each review. Statit offers intuitive dashboards and analytics with industry-leading workflows built into our reviewing features. And this cuts the time spent during reviewing credentialing cycles so you can get back to patient care, patient engagement, and patient satisfaction. Our expert workflows pair with an intuitive user interface and market-driven features to provide a seamless user experience that saves time for our busy users. The system automatically sends chiefs, chairs, users, experts, administrators, any user in the application, automatic notifications which can be utilized to provide relevant information and alerts about upcoming review activity, team performance, or projects that are being monitored with Statit. The system easily drills down to appropriate detailed information, which includes patient encounter and detailed study results. Overall, Statit provides custom alerts for any users and any indicators in the system, and these alerts are triggered by key actions like statistical process control alerts, changes in data sets, and target alarm benchmark violations. So to give a little more flavor to these, I'm going to walk you through each of the key application features and go into detail on some of the great functionality and benefits to solve your key market problems. First is the provider scorecard. The provider scorecard gives your physician leaders a visual indicator of performance so your chiefs and chairs can easily identify outliers that require additional review. On top of that, provider and peer comparative data is available to strengthen your data story across your organization. Data can be rolled up across multiple periods, multiple period types for all of your varied reporting needs. This includes custom cumulative rollups and review period rollups in addition to our most recent period, which is our default value. This provides a holistic view of your provider performance in a customizable scorecard that's still standard. Our batch review feature is new in version 7.2. Which was the last version released to market, and our clients have raved about our batch review feature. They call it a game changer in the provider review industry. Batch reviews allow you to confidently focus on bottom performers while grouping your top performers based on targets, benchmarks, and performance thresholds, and signing off with a single batch review. Using Statit's batch review workflow, you can easily increase your productivity during your semi-annual review cycles, and ultimately this gets you back to patient care, spending less time doing administrative work. You can report confidently during your regulatory audits, knowing exactly how your physicians and clinicians are stacking up against one another. And finally, our quality scorecard returns your investment to you by allowing you to prioritize improvement. As we noted before, we utilize statistical process control as our measurement standard within Statit. And this gives your experts the ability to interactively work with their data using our time-tested expert and performance improvement workflows, allowing you to build consensus by using objective data to support your daily decision-making. In addition, Statit allows your organization to move forward on key reporting initiatives without a heavy dependence on your IT resources. Many of our clients manage the system within their medical staff or their quality department. So Leanne, why don't you explain some of the outcomes and benefits that our clients have realized using our provider and quality scorecards?
Sure, Dustin. I would love to tell all about what we hear from our clients. We tend to place this feedback into 3 buckets that can be seen on this slide. Time after time, our clients share their success stories with regulatory audits by the Joint Commission, DMV, and other accreditors. They receive the highest compliments for their amazing workflows that actually exceed regulatory expectations. Our cost studies support industry research that excess time really is spent in administrative tasks. That's why we've mastered our industry-leading workflows to provide our clients with repeatable and intuitive processes that get users out of the system and back to patient care. This saves up to 80% of their time and cost during review cycles. Whether it's a Six Sigma initiative, Lean, Agile, or any other process, Statit provides confident reporting measured against statistical process control. The quality scorecard workflow with process phases allows the tracking and trending of performance improvements. This workflow can easily be seen by C-suite executives from the beginning of implementation and followed through to completion of the project. Our clients overwhelmingly prefer our Statit provider scorecards to our competitors. They approach their regulatory reviews with confidence. As a nurse that worked in a hospital for many years, I know how stressful Joint Commission surveys can be. We all spend so much time and effort preparing for these surveys, and sometimes we receive less than positive feedback. That requires us to modify the way we do our job. Linda from Cleveland Clinic, Indian River, is a long-standing Statit system administrator that recently upgraded to our latest version. After a recent survey, Linda told us that the Joint Commission was very complimentary of their provider scorecards that she uses for OPPE. This is the type of feedback that we all want to hear after a survey. Our clients are also having big wins with the quality scorecard module. When COVID was new, many of them needed a way to monitor their number of cases and even the amount of PPE supplies they had on hand. Since Statit uses such a variety of data sources, many of them easily found the answer to their problems and created a COVID scorecard within Statit. Conduent provided a guide with suggestions for the initial build, and our customers took those ideas and ran with them. Debbie from Valleywise Health in Arizona is a Statit system administrator that participated in a recent beta partnership with Conduent for our quality scorecard enhancement. We received a lot of great feedback from Debbie and our other beta partners that our quality scorecard workflow is very intuitive and visually appealing. The dashboard and scorecard reviews present a lot of data up front without additional clicks and are very easy to navigate. So as you can see, Dustin, the Statit quality scorecard solution sets our clients up for success, and they are even getting compliments from the Joint Commission.
That's great news. It's great to hear wonderful feedback from our clients. Thank you for that, Leanne. So what we hope you can glean from this session today is that our Statit provider and quality scorecards can help you achieve excellence within your organization. The right technology and workflows have a huge effect on how your organization can balance administrative obligations with patient care. In addition, reducing your operational footprint is what all of us are trying to do these days, and utilizing our data visualizations and workflows and process improvement techniques can help reduce costs up to 80% and remove dissatisfiers in the physician quality review process. This provides key wins in efficiency, productivity, and your bottom line. If you'd like to learn more about Statit provider and quality scorecards, we'd love to hear from you. You can visit the Conduent Healthcare Provider Solutions page by clicking the link in this presentation or navigating to www.conduent.com and searching for the healthcare provider under the solutions menu. You can also email us at hcprovider@conduent.com. We're going to open up for some questions now. So Saul, I'll go ahead and hand it back to you.
Okay, Dustin, thank you very much. And Leanne, thank you for that insightful presentation. Let me see here. All right. Again, if you have questions about the content that you've just seen reviewed with Leanne and Dustin, please feel free to send them through the chat. And with that, I will direct my first question to you, Dustin. Can you provide an example of how Statit produces value and return on investment to Conduent partners?
Sure, Saul. Well, let me start by just mentioning over 350 of our client partners utilize Statit provider scorecards for their semi-annual provider review process. As Leanne mentioned, we hear success stories over and over about how our clients are meeting and exceeding accreditation standards with the Joint Commission, DNB, CIHQ, and other accreditation agencies who provide deemed status for CMS. So this includes not only health networks and hospitals that range in size from corporate multi-facility all the way down to single facility and even critical access hospitals. In addition, our clients have utilized our quality scorecards with SPC measurement to help save effort and millions of dollars on bottom lines through projects with frameworks like Six Sigma, Rapid Cycle Improvement, Lean, and others. The return on investment is clear, and our clients enjoy continued accreditation and cost savings using our tools and workflow, and our cost studies support this as well.
Okay, great. There's a demographic question, I guess, out of curiosity. Do you have a sense of the volume of clients that we have currently on Statit?
Yes, we're in about 500 facilities nationwide. So, and you know, gaining steam every day. So about 500 acute care hospitals within those segments that I mentioned, corporate multi-facility all the way down to critical access.
Okay. Let's see. Why is workflow such an important aspect for physician leadership when it comes to the review time?
All right. The number of providers in a peer group really defines what the effort for a provider review cycle is going to look like. And so thinking about the time spent doing administrative work, as we noted, one of our primary pain points is that this is important time taken away from patient care and clinical duties. When you think about chiefs and chairs, these are the highest paid resources in a medical staff. And so reviews become even more expensive. Our time study was performed with a sample of 10 hospital specialties across a sample of hospitals within our client base. And we saw that clients that have peer groups with 100 or more providers across those 10 specialties, it can cost up to $350,000 per review cycle just in time to complete reviews by chiefs and chairs. We know that most organizations have many more specialties, 10 was is a small sample number of those. And so this number can be much higher at larger organizations. Because of this, workflow is extremely important in ensuring reviewers and providers are in and out of the system quickly and efficiently.
Well, that number certainly got my attention. For the rest of you, if we still have questions that you want to direct towards Dustin, please feel free to enter them into the chat. Okay, Dustin, it looks like we've run our, well, okay, we've got one last one here. In terms of advice, what advice do you have for leaders who are maybe on the fence about acquiring Statit scorecards?
So the first thing I would do is to evaluate the effort for quality and medical staff reporting through existing tools, BI tools or competitor tools that our clients might use. And if you're surprised by the enormous amount of resources being expended for these critical processes, we want to have a conversation with you about how our provider scorecards and our quality scorecards can contribute to a healthier investment in your physician leadership, your accreditation, and also your bottom line.
Okay. Looks like we had a couple more pop in there. In terms of alerts, you mentioned something about alerts. Can you talk a little bit about how that works when it comes to alerting your users or your providers?
Definitely. Our notifications are built into our feature functionality within Statit. This is broken into different segments based on user type. However, our provider notifications, reviewers are sent reminder notifications about what they have upcoming on their plate. They can receive notifications about provider performance when a statistical process alert or a target is breached by a provider for an indicator. In addition, providers can receive notifications through the application as well to understand and interact with the provider review process. Default notifications are sent when a review is started in the application and when a review is completed in the application. So there are multiple touch points for providers and reviewers. On the quality scorecards, in the quality scorecards module, customization is key to notifications, and administrators and users can customize their notifications however they choose for any indicators within the application that they have access to, based on any of those triggers that we talked about earlier. So notifications play a crucial role in the workflow of our users within the application.
Again, Dustin and Leanne, thank you for your presentation today. We'd like to thank all of you for joining. Hopefully you found today's session informative and insightful, and it piqued your interest in Statit. So thank you for joining, and we hope you have a great day.